celebrating the dedication, compassion, and impact of nurses everywhere who show up every day to care, advocate, and make a difference in people's lives. I'm excited to be joined by two incredible guests, Cote and Amy Visser-Lynch, both nursing professional development specialists with Mount Ascutney Hospital and Health Center in Windsor, Vermont. Together, we'll be talking about their experiences in nursing, what National Nurses Week means to them, and the evolving role nurses play in today's healthcare landscape. Whether you're a nurse yourself, work in healthcare, or simply want to learn more about the people behind patient care, this conversation is for you. So let's get started. Karen, Amy, welcome to the show.
Thank you.
Thank you.
All right, we're going to dive right into this, ladies. As we celebrate National Nurses Week, what first inspired each of you to go into nursing, and what still keeps you in it today? So who wants to go first?
I go first. It's Karen. I've wanted to be a nurse since I was 8 years old, so quite a while. My grandmother was a nurse who was also an educator. It's kind of just in my blood. It's something that I've always been interested in. I keep coming back to nursing and staying in the profession because it's really exciting to me to be able to teach the next generation of nurses the profession that I really love and am so passionate about. To see our new nurses be able to connect the dots as they progress towards the end of their academic journeys, and then to see them later on in their career being successful and knowing that I played a part in that is really just an indescribable feeling.
All right, well said, Karen. How about you, Amy?
So for me, again, at a very young age, I was actually for Halloween, I was a Red Cross nurse when I was
Love
about
it.
5. But I also was a candy striper when I was in high school at a local hospital, which they don't exist anymore, but we used to get dressed up and you'd go sit with people and read books to them and stuff. I was always interested in it. And then, I left nursing for a little while, and mostly because I didn't have the support and the resources to keep going. And then went back to it years later. And it's like an old pair of shoes I put on. It feels great. And I love the education side of it because it allows me to feel that I'm reaching more people and I'm helping more folks, because the people that I educate are providing that care out to others. And it just kind of is like it continues to spread. And I love that, the thought of that spread of excellent care going out throughout the community.
Yeah, I totally agree with you about the continuum of care and how you deliver it to patients. I don't think things have really changed that much throughout the generations, but I think that, the technology obviously has improved, but I think when you get down to patient care, I think a lot of the tenets are still the same. Don't you agree?
I do, totally. I think that there's a lot that still reminds me of Florence Nightingale and a lot that has come a long way since then.
For someone in Vermont, especially in a rural community, what makes nursing a meaningful and worthwhile career choice right now?
I think it's really important to enter nursing right now, specifically in a small rural community, because we really get to know our patients on an entirely new level. We are small and we are personable. We are caring for our community members. And the other thing that, is important to think about is that at our small hospitals, we really support one another as a whole. We know everybody's name by first name. We're not just a number. Us as nurses, we get to use all of the skills that we were taught in nursing school. We don't have a lot of resources to depend on. So we have to know how to put an IV, and we have to know how to put an NG tube, and we have to know how to respond to an emergency. So I think there's something to be said about working at a small hospital in Vermont. It's really a meaningful, rewarding area to work. And I just happen to live super close to work. I can ride my bike, and that's, just an added benefit of being in a rural hospital.
All right, Amy, how about you?
So similar to Karen, the partnership with your community members in being able to help them through their rough patches or whatever, helping them reach their health goals, helping to, bring that, that the person you see in the supermarket and knowing that, you've made a difference or you helped their kid or any of those little things, it really is just rewarding because when you see the folks out in the community or wherever afterwards, there's always this appreciation, and it just makes you feel better because you're taking care of community. And for me, it's that partnership with people when you're caring for them that means the most.
I think that's what's special about Vermont in general. I think everybody knows each other. There is less than 6 degrees of separation, especially in small communities like Windsor. And I understand what you're saying about that real affection and connection with patients and with the community. I think that's very evident in the way that you deliver your care.
Mhm.
So we hear a lot about shortages. And so what do you think is the biggest misconception that might be stopping people from considering nursing as a career?
I think some of the things that stops people from entering would be just the misconception that, I'm only going to work 12-hour shifts. I'm going to work weekends and holidays. Or maybe there's a lack of resources, or maybe they've talked to somebody that's in nursing currently and that has advised them not to go in because maybe they're having a really hard time, or it's difficult in the system right now. So I think those are some of the things that I would really think that are some of the biggest misconceptions for those entering nursing.
All right. Amy, how about you?
I agree. I think sometimes, people still think of nursing as just that one thing of like cleaning up and doing stuff. And it really is a science and an art, and it requires people to have knowledge, technical skills, and all of those soft people skills. And so I think it makes it hard for people to think of how they can put nursing to work for them in something that they would enjoy, because they might not like one part of it. But nursing is so huge. There's so many different avenues to go on. But I think the cost of college, lack of resources, transportation, how do I take care of my family? Nursing school really kind of keeps you there for, like a full-time job. And so it's hard if you don't have the other resources to survive in the rural community. I mean, there's not as many opportunities for you to do something or have, an easy right down the road place for you. And so I think all of that adds up, and it just feels unattainable to some.
Right. And if you were talking to a high school or college student in a small town, how would you sell nursing to them?
This is a great one. It makes me feel like I'm selling a car. Um, But I would actually start by asking them what their interests are and seeing how I could connect those interests to the profession. I would really kind of highlight the thought that, we are taking care of people at some of their most vulnerable times of lives. We see birth happen and we see death happen, and really try to connect those dots. The other thing I would try to probably do is, since I'm an educator at Mount Ascutney Hospital and I'm a nursing pathway advisor, I would really try to sell them on the fact of coming to work at our organization and helping us put them through nursing school. So we have a pathway program where, if a nursing student wants to go to nursing school, but they're having some financial difficulty, we can help them with that. So I would really try to sell them on that quick, easy path, but where we would support them and help them through nursing school. And lastly, I would also tell them that nursing is one of those professions where you meet people unexpectedly and they come into your lives and you don't realize how much they are going to shape the person that you are. I've had many people come into my lives who've become my mentors, and for that, I'm very grateful. And if I didn't enter nursing, I would not have those people who have helped me become who I am.
All right. Amy?
So for me too, I think it is a lot about those mentors and those people throughout my life. I can recall certain patients and educators and others that have molded me into who I am. But I think the one thing that I'll say is finding out what's interesting to them and locking that into a healthcare career is really important. I remember we used to do a Dare to Care program prior to MedQuest here at Mount Ascutney. And several years ago, there was a young man who joined the Daring to Care, but he was not interested in healthcare at all. But his parents said he needed to come and do this, so he was doing it. But he liked drama, and so we entered him into the world of moulage and simulation and all of the things when we practice and we try and make real life events. And it was a way to connect him to it, that he had fun and he stayed with the program and really, got to see that there are other things in healthcare you can do. Not necessarily all of it is nursing, but that it's still helping build and educate and grow the healthcare of the next generation. So I think it is really looking for those opportunities.
Well, and you provided a perfect segue for me to talk about MedQuest very briefly. We're thrilled that we're going to be joining Mount Ascutney Hospital and Health Center this July for one of our MedQuest programs. And it's going to be offered July 29th through the 31st. And Southern Vermont AHEC is still accepting applications, so you can visit our website at svtahec.org, and you'll be able to download the application and submit it. And like you have said, both of you, so eloquently, pathway programs, these opportunities for high school students, college students is so important to them. Even going down into middle school, they need to see the opportunities, the options, and be able to take advantage of them if they can. So I'm looking forward to joining you all this summer. And I know you've probably got some great stuff planned. And we're going to have a full roster of students, hopefully, to be able to benefit from this program.
Yeah, we're looking forward to it.
We're excited for it.
Yeah. So recruitment is one thing, but retention is another. What makes nurses stay, especially in smaller rural hospitals?
Wow, this is a really great question, because it's really segueing to a lot of work that I'm doing with our preceptor program and our nurse residency program currently. But I think one of the themes would be being supported and meeting the new nurse where they are, because every new nurse that comes into our organization has a different learning need, has a different need in time management, has a different need in general and how they deliver nursing care. So I really think a supportive culture and giving them everything that they need in order to be successful. And just because we have a certain pathway doesn't mean that they're going to fit in that certain pathway. And how can we help them be successful if they are not meeting those needs or meeting the standards of that pathway? Because everybody is going to be very different. So I think the biggest thing is support, especially for our brand new nurses coming right out of college, and they don't have a lot of, if any, healthcare experience. So I also try to think of how would I like to be supported if I were a brand new nurse, and that is having a mentor and having a qualified, trained preceptor, and just meeting me where I am and being safe to go and ask questions.
All right. That was wonderfully. And Amy, I'm sure you want to jump in.
Yeah, and I think what Karen is saying is, like, the old adage, nurses eat their young. It's stopping that type of thought process around it, and really helping to get people to have those, again, mentoring and coaching. It's not necessarily about, everything, but especially some of the new nurses, they've never even had a job yet. They're navigating people skills that they've never had to use before, as well as new techniques and caring for people. And by gosh, caring for people is very stressful, especially in the beginning. You don't want to hurt anybody. You're worried that you might hurt somebody. There's so much that goes on during those first years of nursing until you kind of find your feet, but especially with the soft skills and some of the other skills that are needed. I think most everybody leaves nursing school with the knowledge. I think it's the practicing those technical skills and getting those opportunities, and then also really developing those soft people skills, because I think that's really what becomes the most challenging piece for people. And retaining people means making sure that they're able to develop and build those soft skills and be part of the team.
Do you think, both of you, that nursing schools are redirecting their focus nowadays on the soft people skills when they're presenting the training to the students?
I would definitely agree. I think that there is some talk about changing curriculum to include some more of those soft skills, because what we're seeing is that this current generation, they are maybe a little bit weak in those soft skills in the communication and how do you talk to a provider and how do you give feedback or how do you receive feedback. So I think there's a lot of work that's being done to help our new grads.
Yeah, I would say definitely. I was on one of the school's advisory board meetings the other day, and we were talking about just that. Also about wellness and self-care so that they're not burning themselves out. I think that's another piece of, nursing, is that people think it's just so hard and you just burn out and you're just always having to work. And so I think the fact that you can wrap in self-care, wellness, and those soft skills, a lot of them are starting to do that, because it is probably going to be like one of those things for a program to be accredited. They're going to have to start including those items too.
Do you feel that at Mount Ascutney in particular, do you feel you've rebounded since COVID in terms of attracting nurses and retaining nurses?
Absolutely. In fact, I have just completed the structure and content for our brand new nurse residency program here at Mount Ascutney. I have 2 cohorts, each with 6 slots, and I currently have 10 new grads coming in this summer, which is going to be absolutely outstanding. Amy's helped in some of the curriculum developments, specifically the self-care, wellness, trauma-informed care to help our new grads, because it is, like Amy said, it is so important to make sure our nurses know that they have to take care of themselves. They have to take their lunch break. They need to take a break, because if we can't sharpen our axe and relax and take care of ourselves, how can we take care of others? So we are definitely attracting new grads, and we are so excited about them coming into us this summer.
Right. That's great. Amy, did you want to say something?
I was just going to say, we also partner with the schools. And so both Karen and I have been shared faculty and faculty at schools in programs and have done all kinds of things to just try and help keep promoting stuff. I was doing LNA testing for the state one point because we didn't have anybody locally that could do that. And people couldn't travel to get tested. And so I was creating that and doing that. We were doing all kinds of things to help support some of the high school programs in providing, clinical space. We've increased the amount of clinical programs that we allow to come in now to kind of continue to keep bolstering those pieces and develop the programs. I think I've been working with the Vermont Collaborative Workforce, and we've been with the Vermont Roundtable and UVM and all other folks from hospitals around the state of Vermont on how we can develop programs across the state and how do we make them accessible, affordable, and meet the support needs of the students. And so this is really it's been great work and work that we're continuing to do.
That's great. And so, how can rural hospitals in places like Vermont compete with larger systems when it comes to attracting and keeping nursing talent?
This is another great question. Having worked at a larger institution myself, and also having worked at a smaller institution such as Mount Ascutney, one of the bigger things is that I want to be heard. I want to be able to come to the table, and I want my voice to be heard. If I bring a concern to the table, I want to have a good discussion with my leadership team. And at Mount Ascutney, we have that ability to sit down with our leaders and really have really good conversations about, practice issues or things that are going on. Another thing that I would think is really important to make sure in helping us attract is that work-life balance. Our newer generation of nursing students and new grad nurses, they want to make sure that they can have that work-life balance. They want to travel. They want to do all the things. They want to go back to school. So how can we really be flexible enough to make sure we can staff our units safely, but also make sure that we're taking care of our nurses? So, and to me, work-life balance is very important, knowing when I need a break. And I want to make sure that my nurses as well, we can retain them by giving them that flexible schedule and that work-life balance.
All right. Amy?
I agree with Karen on that. I also think that some of the ways that we retain people is really around our culture. I think in working bigger hospitals versus smaller hospitals, the voice and everything at the table too. But I think the other piece that happens is that you develop relationships with the people at work. It's almost like a second family. And I've noticed that when I've worked in the rural hospitals, usually the first thing people say is, what's the right thing to do for the person that we're talking about? And we don't talk about money or other things. Like in that rural environment, we are actually concentrating on the person more than we are a bottom line or a number or, not that those things aren't important, but first let's figure out what's the right thing to do for the person. And then we can figure out how the other pieces need to work to make that happen.
I think I agree with both of you. I think this generation is more about work-life balance and culture and being able to just enjoy their life in Vermont or wherever they end up. I don't think it's as much about dollars and cents as we think it is.
Absolutely.
Yeah.
Yeah.
So I know you touched on this before earlier, but and we can talk about it again, but what role does mentorship, training, and professional development play in helping new nurses feel supported and not leave after those first tough years?
Yeah, those first couple years are very, very tough. And what they need most in those couple years is support. And they need to know that they're not alone. They need to have somebody they can go to, they can confide in and talk about their day. We've all been there, us as nurses, we've all experienced those new tough years. And every time we go to a different position, the first year or two can always be tough because then you become a novice.
All over again.
Yeah, novice all over again. And one of those ways that we're going to help support our new nurses coming through here in the organization is, again, our nurse residency program, our nursing pathway programs, because that's how they're going to be successful in my opinion, in my experience, is that just the support. And what's their end goal? So where do they want to end up? Even if they may not stay here at our organization, how can we support them in becoming the best nurse with that professional role development? And how can we just help them get there? And that's okay that they may not stay here.
Right. Amy, did you want to add anything?
Yeah, I'll say, so the mentoring part is really important. I have mentored many new nurses across the country, actually, because I do it as a virtual item. The American Nurses Association has this mentoring program, and I have many times mentored new people. And I really think it's listening to them, letting them vent, letting them feel that they have a safe space to talk about it, and really being able to share their emotions and then help them to work through that piece so that they can get to the other side. Because I think if they keep some of those emotions bottled up when you're nursing, some of them are, there are times when little pieces of your heart seem to disappear, and it makes it harder to move forward and move forward and move forward. And so helping them work through those things, I think is hugely important. And a mentor and a coach that's exactly what they're doing. They're helping them reach their end goals, but they're also helping them get through the tough times. They're the person they can call and just unload on and then help work through it.
Right. Thank you. And this is our final question. If you could change one thing locally or nationally to strengthen the nursing workforce, what would have the biggest impact?
This is an easy one for me. We need more qualified educators to increase the number of nurses coming out, not only locally, but nationally. We are in a current nursing shortage. We have nurses retiring. We have nurses leaving the profession for many different reasons. We also need to support our nurses who are passionate about education. So such as our preceptors who really are developing a love for education. We need to help them see the way to become educators and support them financially and with schedules and all of that, because I've been an associate professor before, and I know the dedication that it takes to become one of those. And that is probably one of the biggest impacts to being able to help change our nursing workforce and or strengthen that workforce. I know that was probably one of my greatest successes as a nurse, was being able to train hundreds of nurses and just see them come out, graduate, and see them in jobs. So I want more education for nurses to become educators.
All right. And Amy, you must have
Well,
comments.
Yes. So I agree. We do need more educators, but I also think that we need more workforce collaboration. You know, Vermont has now joined the nurses license is now part of the compact, so you can work in several states. I think there are some things where there could be and should be more standardization across the states in regards to education, licensure, and things like that. I think the other piece, though, is also remembering that there's all this other support staff that also has to go with nursing. So when we talk about nursing, we really need to broaden that out to some of the other roles, because the nurses can't do their jobs alone. There needs to be all of these other folks that are helping. And so how do we help support those positions as well? And I think, healthcare collaboratives like the Vermont Talent Pipelines Healthcare Collaborative that I've been working with for the last, I don't know, couple of years. And it's where the RN pathway program that we have now came about from, and we're still working on more. But those are the types of things I think we need to do more of. It needs to be more accessible and easy, and we need to have more easy ways for people to get the information. It's hard to navigate some of those things, just like it's hard to navigate the healthcare system. It's hard to navigate academia too at times, and finding that right pathway. So having more of those opportunities and easy pathways for people to find their way to what they want.
All right. Well, both of you have been fantastic guests, and this has been such a enlightening and rich discussion. I want to thank you both for joining me on this special Nurses Week episode of our Let's Talk podcast. And a big thank you, of course, to Karen Cote and Amy Visser-Lynch from Mount Ascutney Hospital and Health Center for your insights, your stories, and the important work that you do every day. Your dedication truly makes a difference. And to all the nurses listening, thank you. Your compassion, resilience, and commitment do not go unnoticed. If you enjoyed this episode, be sure to subscribe, share it with a colleague, and join us again for more conversations that highlight the people making an impact in healthcare and beyond. Until next time, take care.